Hello. This presentation is to provide participating partners and other affected persons and parties with training about the Better Health for Northeast New York Performing Provider System, or BHNNY PPS, compliance program, and the requirements and expectations necessary to support and benefit from participation in any of BHNNY's programs or activities. All partners, including the members of their workforce who support the BHNNY projects, board members, and organization executive leadership, are required to complete this training. In addition, any providers or other organizations engaged by a partner in an activity to support a BHNNY project must also complete this training. Organizations who participate in government programs are expected to have implemented an effective compliance program consistent with the guidance of the Office Inspector General and the New York State Office of the Medicaid Inspector General. Providers may be required to have a compliance program already. The compliance program for BHNNY does not replace that requirement, but rather supplements it for those additional activities required by our participation in the DSRIP program. The BHNNY Compliance Program, Code of Conduct, and other pertinent policies can be found in the compliance section of our website at www.bhnnypps.org. In order to participate in the DSRIP program, a partner must have implemented an effective compliance program that meets the requirements set forth under state and federal regulation. The compliance program for BHNNY includes only those activities unique to DSRIP. That means providers may be required to implement their own compliance programs to fully meet the requirements for participation in government programs. As shown on this slide, an effective compliance program includes both required elements and various processes and outcomes to improve the culture of compliance in your organization. You should confirm with your compliance officer how this works at your own organization. It is each of our responsibility to take the necessary steps to detect and prevent fraud, waste, and abuse in healthcare programs, including prohibiting retaliation and intimidation against anyone who reports a concern made in good faith. There is a myriad of laws, rules, and regulations governing the participation in government healthcare programs. Each provider is responsible for knowing the applicable rules and regulations that apply and how they apply to their particular sites and services. I will highlight a few of the more significant of those laws here as they relate to DSRIP. Any person who has knowledge of, acts in deliberate ignorance or in reckless disregard of the truth, and presents or causes to be presented a false or fraudulent claim, makes a false statement, or improperly avoids an obligation to a government entity or conspires to engage in such activity has committed a False Claim Act violation. In addition, as described above, providers are responsible for proactively developing the necessary systems to prevent, identify, and report Medicaid payment discrepancies. BHNNY's website provides our project plans, implementation plan, and links to relevant resources to aid each of us in complying with these requirements. In addition to the False Claim Acts, both federal and state, there are other laws governing our participation in these programs. The Physician Self-Referral, or STARK law, limits physician referrals when there is a financial interest with the entity. The Anti-Kickback Statute prohibits soliciting or receiving anything of value, directly or indirectly, in return for anything that results in fraud, waste, or abuse of government programs. Civil monetary penalties may be levied for various violations, including payments to reduce or limit services, payment to beneficiaries of government health care programs, or use of excluded persons or organizations, to name a few. The antitrust statutes respond to a variety of concerns, including acts that may result in restraint of trade, price discrimination, or arrangements that lessen competition. EMTALA, or the Emergency Medical Treatment and Labor Act, covers required screening and treatment of patients who come into an emergency department regardless of their ability to pay. These are only a few of the applicable laws and regulations governing the provision of healthcare services and our DSRIP program. More information can be obtained through the BHNNY website, by contacting your organization's compliance officer, or by contacting the BHNNY Chief Compliance Officer, Noel Hogan, or the BHNNY Compliance Officer, Todd Fauble. Contact information for both of the BHNNY compliance officers is provided at the end of this session. It is the goal of the BHNNY Compliance Program to rectify compliance concerns promptly and thoroughly, implementing systems to reduce the potential for recurrence. Where required, instances of noncompliance will be reported to the appropriate federal or state agency, including the Department of Health, Office of the Inspector General, and the Office of the Medicaid Inspector General. Those who violate BHNNY's compliance program will be subject to disciplinary action in accordance with the applicable policy. We each have an important responsibility to make sure that the integrity, confidentiality, and availability of patient records are ensured. Information covered under the HIPAA and HIPAA High-Tech and related state privacy provisions include all individually identifiable information known as protected health information, or PHI, that are related to past, present, or future health conditions, the provision of health care, or the payment for such health care created or received by a covered entity. Partner organizations are expected to have in place effective programs that meet the requirements of the Privacy Rule and the Security Rule of the Health Insurance Portability and Accountability Act, or HIPAA, and related statutes, and to protect against all reasonably foreseeable threats to PHI. Individuals should refer to the Notice of Privacy Practices in their organization's privacy and security plans to acquaint themselves with their responsibilities under these rules. Each organization will have a privacy officer who can also be consulted for institution-specific protocols in this regard. We are all responsible for reporting potential instances of fraud, waste, and abuse when we observe them. You are not expected to investigate or prove these concerns prior to filing a report, only that you have observed actions or facts that allow you to reach a good faith belief that fraud, waste, or abuse may be present. If you observe fraud, waste, or abuse, you should first speak with your immediate supervisor about the matter, or, if you prefer, speak with your organization's compliance officer directly or by using a hotline if available. If you believe the fraud, waste, or abuse relates to our district programs or activities, you should contact one of the district compliance officers directly, or you may use the anonymous hotline for BHNNY at 518-262-4369. BHNNY prohibits all acts of retaliation or discrimination directed at individuals who make good faith reports of or participate in the investigation of potential fraud, waste, and abuse. Thank you for taking the time to participate in this training session. BHNNY is committed to delivering our services and conducting our activities ethically and fully compliant with all applicable laws, regulations, and policies. As the programs of BHNNY continue to evolve and become active over the life of this initiative, additional training sessions and materials may be made available. If at any time you feel more training is required or other materials are needed to clarify your responsibilities and programs under DISRIP, or if you have any questions related to this training or the BHNNY Compliance Program, please contact your organization's compliance officer or the BHNNY Chief Compliance Officer. As noted on the BHNNY website, our district has an Audit and Compliance Committee responsible for continually updating our training on these matters. Each compliance officer may contact any member of the committee or the BHNNY Compliance Officer if they believe changes or additions are needed to these programs. On behalf of all of the partners involved in the BHNNY PPS, thank you for your participation in the effort to improve the quality of care in our region.